We're on.
Hi, I'm Don Martin, and I'm one of the supporters of Colorado Care, which is a new amendment that's coming out in the general election this November. It's called, excuse me, Amendment 69. In Amendment 69, we are proposing that we have a single-payer program here in Colorado for Coloradans. It will cover, it is a comprehensive plan that will cover every legal Colorado resident. Nobody is left out. Now, how the system works is this. It's basically very similar to what you have in most countries, but this is on a state level. Now, remember, today, we deal with insurance companies from Hartford, like a Hartford Group or United Group, all from the East Coast. Now we're going to have an insurance company where we pay into, and the pool is run by Coloradans. Jobs go to Coloradans, not to a phone answering person in the Philippines or an executive in Maryland. It's done, all of it is here. That's a big plus. Here's another thing that's really great about Colorado Care. With the swipe of your Colorado Care card, when you go to your doctor, any doctor, you get to choose any doctor, any surgeon, any hospital. When when you go there, you swipe your card, and immediately your whole medical history is in front of them. This is unheard of anywhere in the United States.
Does this happen in Canada?
And that's how they do it in Canada. Mm-hmm. I'm a dual citizen, and I'm a member of British Columbia Healthcare. And when I go in there, all I do is I take this card, as you can see, right there is my card for British Columbia, and that's my health number. I'll flash it real quick so you don't use my number now.
All right.
And I pay no copays. I pay there are no max caps on the amount of service that can be done. My doctor in 22 years has never been turned down on a request for a procedure. There are no deductibles.
How long will you guys be here?
In Canada, in British Columbia, the cost is $56 a month US. Colorado is going to do it differently because this is a state-managed healthcare program. There will be a 10% tax taken out of your paycheck. 2/3 is paid by every employer, and 1/3 is paid by the recipient of the care or the employee. Now, we're figuring out if you're making about $35,000 a year, your cost is going to be about $100 to $125 a month. Okay? So the more you make, the more you pay, the more you can afford to pay. Now,
What about seniors?
seniors, Medicare, all the programs the seniors are in, veterans are in, all these special programs are all wrapped around by Obamacare. Obamacare also, if you're in Obamacare, this all gets wrapped by Colorado Care. And then Colorado Care will, if you keep Medicare, which of course you will, they work it out between themselves. There is something in Medicare and especially in Obamacare that addresses any states that want to create their own health system. So this is not unknown territory. This has already been thought about, discussed, and they're prepared to take us on. Now, let's talk. A lot of people say, well, they're going to deny you coverage. Well, that doesn't happen in Canada. It doesn't happen. I live in France in their system. They don't turn you down. The government in single-payer systems just pays the bill. They don't argue with you.
What's wrong?
They just get the bill and they take care of it. That's how the system works. Now, you get to pick your doctor. You can go and say, I don't like that doctor. And you go and look in a list of physicians and surgeons and stuff, and you say, okay, I'll take this doctor. He seems more what I need. If that doctor's taking patients, any patients, he will take you. Because he knows you're not like a Medicare, which will squabble about prices. Colorado Care just pays his bill. So actually, when I went to the opening meeting of Colorado Care in Denver, 80% of the people there were physician and medical related people because they are sick and tired of being told you can't do this and you can't do that.
So they're all for this.
They're for this. Now, what's really exciting about this thing is that this is something that we can finally take care of all Coloradans. Whether you're living way out there in the Gunnison or you're right here in Colorado Springs, everybody gets coverage. All you have to do is register as a resident of the state of Colorado, and you go on the program. Now, if you're indigent and you're poor and all that,
That's me.
then you just come aboard. You'll get a card. There's no problem. We look at your situation and we take care of it. It's the same thing in Canada. That $56 I would pay for BC Health, if I'm making less than $25,000 a year, there is no charge. We have to take care of our own. In this country, the country is great, founded on such great principles. How can we not take care? You judge a country's greatness, how it takes care of its weakest people.
Absolutely.
And this is one of the darkest elements of this movement we've seen in America of greed. The Donald Trumps and the
Koch brothers,
the Cruises, and all those guys. They don't care. They look at you once you have spent your life working and struggling, making this country better, and you can't do that. Now you may as well just go and die. We don't care about you anymore. Remember, and I'm a Democrat, I tell you that right now, I'm a progressive really, but I'm going to tell you something. When I look at them who call themselves the Christian right, they're doing all the things that Jesus would never do.
Jesus would never get in the party.
That's right. Well, he would just freak out. He said, where do you guys come from? And they're all carrying a Bible in one hand, and they're cutting the throats of, they want to save a baby before it's born, but once it's born, it becomes a welfare brat.
I know.
What is that about? But let's not get into that part.
No, really.
This is something we really need, and here's Colorado's opportunity. Just like it was the leader in marijuana. Colorado has not collapsed since they brought in marijuana. I use CBD oil myself for my neuropathy.
I as well.
And stuff works. If it wasn't for that, I'd be rubbing my feet all night long every night. And there is no medication, whether they advertise it on TV or not, that works like CBD oil.
Well, speaking of that, what do you think? What does the Colorado Care? What does it have to say about farmers? I mean, I'm 72 years old and I do not take any pharmaceuticals. What works for me is homeopathy and alternative acupuncture. That's where my money
All
goes.
that is included. This is why we call it a comprehensive plan. Just like in Canada, if you look at the province of Manitoba and you have a mental illness, it's not covered because it's not a comprehensive plan. Okay, Canada is a confederation of provinces. It is not a federalist system. Now, like America, where the federal government rules everything. No, not in Canada. It's much more loose. Now, in Canada, Manitoba doesn't address mental illnesses as part of their plan. British Columbia has a fully comprehensive plan. It costs $56 a month. Manitoba is $0. So they didn't want to charge their people the $56, but it doesn't cover certain things. Drug addiction, not covered in Manitoba, covered in British Columbia. Where the biggest, most violent crimes in Canada by drug addicts and mentally disturbed people? You guessed it, Manitoba. Look up the statistics,
Okay.
It's all there. So it's just like Colorado will be hopefully the pace setter for doing these state-run single-payer programs.
Now,
It's going to let each state decide whether it wants to be a Manitoba or whether it wants to be a British Columbia.
Okay. And do you think Bernie's plan for single pay is similar to the one that you're talking, the
His plan
Colorado?
is probably 95%. I don't know every detail of his plan. I'm thinking from what I've read and seen, it's 95% the same. Except he's running it on a national basis, which means you got to deal with Congress. And we're sitting with currently. There's no guarantee that's going to happen after November. We're sitting on a very intransigent Congress that is obstructionist, if anything.
Yep,
and
that's
they
true.
will be they'll be just as obstructionist for either Bernie or Hillary. That won't change because that is the modus operandi of these these trolls that are in Congress on the right side of the bench. So, the aisle. So let's be real here. What we're looking at is doing it state by state. Let every state come to the realization we have sick people, we have dying people because they don't have health care. Remember, Obamacare has saved 11 million people at this point, close to 12 now. But there are still 20 million that are uninsured or horribly underinsured. That ends with Colorado Care. It is a platinum plan. A platinum plan. So if you go to any company like United Healthcare and you see their platinum plan, that's what you're going to get from Colorado Care. Now here's the best part of it all. Right now, Colorado spends $32 billion a year on healthcare. This plan, projected by many economists, is projected to cost about 25 to 26.5 billion. So we're looking at saving over $5 billion a year by instituting this. And where's that savings coming from? It's coming from the pockets of CEOs making $200 million a year bonuses at these giant companies. It's also coming out of the pockets of members of the board of directors who are also pulling in millions of dollars of bonuses. It's coming out of the pockets of the shareholders of these insurance companies. And where it's really coming from is the profits that they make is also coming out of all the denials of service that you're getting. I can't think of one person that I know has not been denied service in their family of one person. At least one time they've been denied something. I've been denied 3 times for hip surgery. So this is the point. And if, by the way, if anybody thinks there's waiting times in Canada, I ask you to go to this site. Just Google this, wait times in British Columbia. It will lead you into a site, you'll point to a person's part of the body. Like I just mentioned hips, point to the hips. And it'll show you, it'll ask you hip operation, hip replacement. You click on yes, and then it's going to show you every doctor in British Columbia available to do hip surgeries. There are doctors that you have to wait a year for. Why? Because they're the most famous doctors. Same thing in the United States. Go to the best doctor in Denver or in LA for hip surgery and you're going to wait a year too. Because they're popular, everybody wants them. Money can sometimes get you to the front of the line, which is what the fat cats want. But for regular people, you don't necessarily have to go to Dr. Smith, the most famous one. As long as he's board certified, I'm good with it. I got 2 replaced hips from Canada. Perfect. It's been 10 years now. Everything's fine.
And this guy
how
was.
long did I have to wait for that doctor?
Yeah.
3 days. 3 days he was available. So the system that we're offering, if you read up about British Columbia Health, there will be always people there who will say, oh, this. But if you ask any Canadian that makes $120,000 a year or less, would they trade their medical for our medical? They'll laugh in your face. They'll say, are you out of your mind?